the government's clearest roadmap yet to restoring some form of normalcy in America. President Trump has laid out the guidelines for gradually reopening the country, starting as soon as today in some states, with a goal of balancing the economy while keeping people safe. But there are concerns that a lack of widespread testing makes it very difficult to truly control this crisis.
Good morning. Anthony, yesterday, President Trump told state governors that they will be calling the shots on implementing this new staggered approach to reopen the country. Now, that is a reversal of his comments earlier this week where he said he had total authority to reopen the states. But this approach gives cover to local leaders who want to get back to business while also shielding the White House from blame if there are new outbreaks.
Based on the latest data, our team of experts now agrees that we can begin the next front in our war, which we are calling Opening Up America Again.
It is a three-phase approach that should only begin after a state sees a 2-week decline in coronavirus cases and encourages a robust testing program for healthcare workers. In phase 1, individuals and businesses will still be advised to maintain social distancing while they gradually return to work. Large venues will also be able to open if they can maintain strict physical distancing.
We did not put a timeline on any of the phases. We want the governors, with the data that they have, community by community, to be setting up those timelines.
If states are able to go 2 weeks without a rebound of cases, they can move to phase 2. Venues, including restaurants, theaters, sports arenas, and places of worship, could operate under moderate social distancing.
Through all phases, continuing the good hygiene practices, continuing the respect for spaces between individuals, because we know that we still have an issue with asymptomatic spread.
As for who decides when to move through the phases, just days after saying he had absolute authority to reopen the country, the president backed down.
We're recommending certain things. They'll be in place dependent on what the governor wants to do.
Dr. Anthony Fauci cautioned that states need to have enough testing and medical equipment to respond to a possible resurgence.
Even if you are in phase 1, 2, 3, it's not okay, game over.
Local officials and business leaders say more testing is needed before they can safely reopen. But this plan does not provide a national testing strategy. Instead, it leaves local leaders to develop and implement their own testing plan.